We want to now turn to the fact that school is back in session, and it's not too late to be catching up on your teens and preteens vaccines. And here to talk more about this is pediatrician Dr. Shapiro. Welcome.
Thank you.
You know, as parents, we know there are so many vaccines that our babies and toddlers need, but as they get a little older, we kind of stop going to, see pediatricians as much as we did before. But there are a lot of vaccines. I know my oldest started 7th grade. He had to have certain vaccines before you can even start. So let's look a little bit at these vaccines because some of them are suggested but not required.
Right, right.
So let's start with the HPV vaccine. This is one that's a little newer for most of us.
Right, so most of us didn't have the HPV vaccine when we were kids, and it is relatively new, and it's for the human papilloma virus, which is a virus that is so prevalent, so it's such an important vaccine. And a lot of pediatricians present it as this is a cancer vaccine or an anti-cancer vaccine. And the reason for that is that this virus is associated with a lot of cancers, cervical cancers, throat cancers, neck cancers. So it's such an important vaccine. It's recommended at about age 11. It could be given as early as age 9, and it needs to be given in 2 doses.
Okay, and this is really recommended for boys and girls.
Boys and girls. And one of the concerns about the vaccine is that people are saying, oh, because it's sexually transmitted, that this is going to promote early sexual behavior, and that is absolutely not the case. It is a safe vaccine, and it does not promote early behaviors.
Okay, and another one that is, I don't know if it's required or just suggested, meningitis.
Meningitis. So that is a bad illness. Nobody wants to have meningitis. Most of us have heard of it. It can cause brain damage. 10% of people who contract bacterial meningitis can actually die. So it is a recommended vaccine at about age 11 or 12, and then a booster at 16.
Okay, because we often, at least I do as a mom, I think about meningitis more in college, but you don't wait that long.
You don't wait that long. Yes.
Okay, okay. And what about Tdap? Now that one you have to get before you start 7th grade, correct?
Correct.
Okay.
So Tdap is the teen version of Dtap, which is given in several doses as infants, so 2 months old, 4 months old, 6 months old, 15 months, and 4 years. And then again at 11 or 12, which is why you need it to enter 7th grade. And that's what's commonly known as the whooping cough vaccine.
Okay.
So that's also required and recommended, and then also every 10 years after that. And that's where the teens sometimes fall off. You're 20 years old, you don't think about getting another vaccine, but you really need one every 10 years.
And I think for so long we thought whooping cough, who gets that? But not so long ago we had a lot of problems with whooping cough.
Right, and we're still seeing outbreaks of whooping cough. It sneaks through. The vaccine is effective, but nothing is 100%. The more people who get vaccines, the more protected the entire community is. So we do still, unfortunately, see whooping cough. So it's a really important vaccine.
Yeah, when you hear those little babies coughing like that, it's just heartbreaking.
Terrifying.
Yeah. Okay, and then the flu shot, it's almost that time of year.
It is that time of year. The flu shot is out. It came out a few weeks ago, and it is recommended every year for everybody, ages 6 months and up. A lot of the kids ask about the flu mist, which is the spray. There is no flu mist this year. There was no flu mist last year, and they don't know when they're going to get it back. It was found not to be effective a few years ago, so it's just the shot. It doesn't hurt. My kids have gotten it, and but it's very important. Again, the more people who get the flu shot, the fewer complications we'll see from the flu this year.
Okay, I must be a big wimp because I think it hurts, but it's better than getting the flu.
It's
so
better
I do it every year.
The illness, yeah.
All right, thank you so much,
My
Dr.
pleasure.
Shapiro. We certainly appreciate that. And for more information from the doctor, we have a link to her website on kcal9.com. Just click Seen on TV. We'll be right back.